Butt augmentations have really skyrocketed in the last 4 or 5 years. I think with images in the media and on videos with the bigger butt, I think it's just more popular. And so patients come in now, and sometimes even with pictures of celebrities with Kim Kardashian or Nicki Minaj, wanting to emulate that look. And so that's why we've seen this meteoric rise in the request for butt augmentations. We started to discover that if you took fat from one part of the body and transpose it to another part of the body, you can augment that second area safely with small incisions that don't get infected. So the so-called Brazilian butt lift became very popular. And what we do with the Brazilian lift is we sculpture the body. It's liposculpturing, really. We bring the waistline in. We bring the lower back, we put a little curve in the lower back, and all these are done with liposuction. And then the fat that we get from doing those maneuvers, we now put into the buttock cheeks, and that gives it the volume. And you'll find that if you narrow the waist and you narrow the lower back, you can actually get the buttock to look a lot bigger than it did before, even without adding any fat. And then when you add the fat, and then it's like, okay, wow. One of the beautiful things about the Brazilian lift is that the recovery is really very short. Because it's mostly liposculpturing and fat transfer, you cannot sit on your buttock for 2-3 days. And so you really have to go from standing to laying down, which can be a little bit annoying, but definitely not something that cannot be done for 2 or 3 days. And after that, you're fine. Now, the final shape is sort of a gradual process, because as you're healing and as things are shrinking, it's looking better and better. You will have to be in a compression garment for about a month, and that's to help keep that shape forming as the swelling goes down. But definitely by 6 weeks, by 8 weeks, you should start to see 80% of your shape, and by 12 weeks, you should see all of it. What we try to do and what we do well here at Jamachi is to sculpture the body and then to get a good feel from the patient as to how big and how dramatic they want to be. Some people want just a subtle change, and some people want like a, wow, knock off my socks change. So we have to sort of gauge what they want and advise them sometimes what really is going to look good on them. And then we put a plan together, we put a very custom plan together on how to accomplish this, and then we execute it, and we execute it well.